Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Desmopressin. Its brand name, or one of its many brand names, would be Noctiva. Now, before I talk about this medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Desmopressin. We'll then look at a couple of examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So desmopressin acetate is a synthetic analog of the naturally occurring hormone 8-arginine vasopressin, or ADH, and is an antidiuretic hormone that affects conservation of water in the kidneys. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of neurohypophyseal diabetes insipidus, as well as in the treatment of nocturia, which would be a condition in which you wake up during the night because you have to urinate. Primary nocturnal enuresis would be treated with this medication, which is the involuntary discharge of urine at night by children old enough to be expected to have bladder control. As well, hemophilia A and Willebrand disease type 1, both with factor VIII levels greater than 5%, could also be treated with desmopressin. With respect to contraindications or reasons we would not be able to prescribe desmopressin, well, we wouldn't give this medication to a patient who had a hypersensitivity to desmopressin or to any other component of the formulation. If a patient had existing or a history of hyponatremia, which would be low sodium levels, we would not give this medication, as well as patients who had moderate to severe renal impairment. I believe a creatinine clear is less than 50 mL per min. This medication is not to be used with loop diuretics or in patients who have congestive heart failure of class 2 through to class 4. Patients with heart failure in general would not use this medication, as well as patients with uncontrolled hypertension. Now for dosing with desmopressin, so in the treatment of nocturia, if it's the sublingual tablets that we're talking about in women, they may use 27.7 micrograms sublingually without water once daily, 1 hour before bedtime. Now for the same situation, but in men, we may see 55.3 micrograms sublingually, again without water, 1 hour before bedtime, and just once daily. For Noctiva nasal spray, for patients that are less than 65 years old and don't have a risk factor for hyponatremia, we would see one spray, which would be 1.66 micrograms, in either nostril about 30 minutes before bedtime. As with all medications, there are some side effects or adverse reactions that patients may experience while using desmopressin, so we'll go over some of those here now. 2 to 3% of patients may experience hypertension or high blood pressure, while xerostomia or dry mouth may happen 12 to 14% of the time. 1 to 2.5% of patients may experience a backache, and 3% may experience dizziness. Fatigue seems to happen 10% of the time, and a nosebleed may happen 3% of the time. This is most likely talking about the nasal spray. Similarly, bronchitis and nasal discomfort coming in at 1 to 2% and 3.5 to 6% respectively. Nasal congestion and sneezing about 3% and 2.5% of the time. Now these last side effects, like I said, are most likely to occur with the nasal spray. 2 serious side effects that may happen with desmopressin would be body fluid retention or hyponatremia. Again, that would be low sodium levels. This can happen up to 17% of the time. Alright everybody, that's all we're going to talk about today with desmopressin or Noctiva. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.